So we're looking at the hip. If we have an impinged hip or we have a hip that's tight, if your hip flexors are tight, you'll probably find that the hip movement is going to come up and it's going to pull in tighten the adductors. And we've got the gorgeous Sarah who's been my model for this morning, so I have a body to play with. So if we're talking specifically about hip impingement, how can we manage the hip impingement? Well, the first thing we want to do is check where the hip positioning is. So if we feel that the hip is up and tight, we can do some release of the adductor muscles, so however you would like to release the adductor muscles. Also the hip flexor muscle, so we're coming in and checking the hip flexor muscle and hip flexors as it comes through from your psoas. But for actual hip joint lobes, then I tend to do them from a hip flexion point of view. So remember, if Sarah's hip is impinging, she's going to get to here and go out. So what we want to do is see if I'm going to go in the groin, is that okay? So if we're here, and I have the leg here, and I'm pulling down, if I then take her into hip flexion, I've given some traction and distraction to the hip joint, and she goes into hip flexion. She should be a little bit more comfortable. So a normal hip bend, as opposed to one where I'm dragging the femur down and then getting hip flexion, will potentially make it a little bit more comfortable. So this is one technique where we're taking the femur head inferior. So that's quarter. Alright, if you have somebody who's got a really heavy leg, Sarah's obviously nice and light, I will tend to strap them up from above. So I'm going to utilise the trap table at the moment and use this as a bit of a lift. So that will then give me hip flexion. Obviously my bar would want to come across here, and then I've got that holding the weight of the leg, and then I can do traction that way. If I also want a little bit of compression to do posterior compression, I can use this and push down through the hip, and if I want to be a little bit more specific and actually get some release through the piriformis at the same time, I can lift that up and underneath, sorry, this is going to hurt a bit, hey? And then I can glide her hip past the ball, is that alright? Glide her hip past the ball, and then also glide past and distract, and obviously hands in here. If you're finding that you've got a really, really heavy leg, we can use a seat belt as well, and the seat belt can go around the hip and around you. It sits behind your tail, and then we've got hip flexion and lateral traction on the hip, or it feels quite nice, doesn't it? And then again, if you want to, I have done it where I've done compression. So I've got glide, especially if you've got a hip joint that's sitting slightly inferior anterior or superior anterior, you're going to find that the actual joint capsule is tight. So it's a nice way to get glide of the joint capsule and traction at the same time. If they're doing this at home, then I generally teach it at home for them. If they've got somebody that can just pop a strap, that strap can be a little bit uncomfortable, so maybe think about a towel underneath it, and they can just get lateral glides or inferior glides, or if they're comfortable with their partner or their parent, they can just use it from here with a manual technique instead. So that's an easy, or the easiest way to get some traction on the leg. Just step out of this. Teaching a client to do it at home, I just trap a microphone. Teaching a client to do it at home, I just have to get my lefts and rights correct with this. I'm looking at you for inspiration here. Empty. So the traction is through here. So you still want this joint to pull, and I will get Sarah to put her left foot in this one here. And then as this leg is lifted and rested on a couch or on a block, she can pull and press with the other leg away, and she'll get like a traction effect on that hip. So this leg, if she prefers, can be down, and she's pressing down with that leg. That's causing a traction on this hip here. Obviously, if I reset this so it's a little bit further and deeper into the hip joint, go again, you'll find that the actual pull then is better. The higher this leg is up, so if she's got that rested on a coffee table, then she's got a really nice traction effect that she can do herself. Yeah. So that's, if you done that one before.
Not this one.
Yeah, so that one's quite nice. If we take this leg out, and obviously the basic traction, if you've got somebody to help you, is just pulling. Just make sure they're pulling from the ankle, they're not pulling from the heel, so you've got traction around the actual shin bone and pulling that way. So in a quick 5 to 8 minute video, we've just gone through some hip traction techniques which are away and down, hip traction techniques that are sort of lateral glide, plus some AP techniques that can help release some of the piriformis and posterior joint capsule, and then techniques that they can use to do those at home.